Hello everyone. This presentation is on Li Zhong Wan, also called Regulate the Middle Pill. It appears on the California Acupuncture Board Examination Herbal Formula list. I will review its traditional pattern, a short hypothetical patient case, 3 potential drug-herb interactions, and a practical management plan. The purpose is educational. Herbal formulas are selected by pattern, but medication safety still requires attention to pharmacology, dose, duration, and the individual patient. Traditionally, Li Zhong Wan is classified under warm interior cold. A representative pattern is Middle Jiao cold from spleen and stomach deficiency with chronic diarrhea, nausea and abdominal pain. Important ingredients include ren shen, baizhu, ganjiang, gankao. The key clinical idea is pattern matching. A formula can be appropriate for one patient and inappropriate for another patient with the same biomedical diagnosis. Before treatment, I would also screen for red flags, confirm that urgent biomedical evaluation is not being delayed, and review the exact medication and supplement list. My hypothetical patient is 57-year-old woman with chronic diarrhea, diabetes and hypertension. The current medicines are metformin, hydrochlorothiazide, warfarin. This case gives a plausible reason to consider Li Zhong Wan, but it also creates interaction questions. I would document the tongue and pulse findings that support the pattern, confirm the diagnosis, and ask about allergies, pregnancy status when relevant, kidney and liver disease, bleeding history, and use of over-the-counter products. Medication reconciliation is essential because many interaction risks come from the combined physiologic effect rather than from one single herb. Interaction 1 is ren shen plus metformin. The mechanism is ginseng may lower glucose. The clinical significance is moderate during poor intake or diarrhea. My management plan is monitor glucose and hydration. I would explain to the patient that evidence quality differs across herbal products and interactions. Therefore, the safest approach is to use a known product, avoid unnecessary overlapping supplements, and pay special attention to medicines with a narrow therapeutic index. Interaction 2 is gankao plus hydrochlorothiazide. The mechanism is licorice can lower potassium and raise blood pressure. The clinical significance is moderate and greater if diarrhea also causes potassium loss. My management plan is monitor potassium and blood pressure. I would explain to the patient that evidence quality differs across herbal products and interactions. Therefore, the safest approach is to use a known product, avoid unnecessary overlapping supplements, and pay special attention to medicines with a narrow therapeutic index. Interaction 3 is ren shen plus warfarin. The mechanism is ginseng has variable evidence for altering anticoagulant response. The clinical significance is potentially moderate. My management plan is increase INR monitoring when starting or stopping. I would explain to the patient that evidence quality differs across herbal products and interactions. Therefore, the safest approach is to use a known product, avoid unnecessary overlapping supplements, and pay special attention to medicines with a narrow therapeutic index. In conclusion, Li Zhong Wan may be reasonable when the patient's presentation matches Middle Jiao cold from spleen and stomach deficiency with chronic diarrhea, nausea and abdominal pain. The main safety principle is not simply to label herbs as safe or unsafe. Risk depends on the specific herb, preparation, dose, treatment duration, the patient's organ function, and the drugs being taken. I would use a reputable product, start conservatively, monitor the most relevant objective values, and communicate with the patient's physician and pharmacist. This presentation is for education and does not replace individualized medical care. Key references include the California Acupuncture Board Examination Formula list, standard Chinese herbal formula texts, such as Bensky and colleagues, Chen and Chen's Pharmacology and Applications text, and evidence-based drug and herb interaction resources. Thank you.